What if I told you you don't have to do all these boring revision notes, which is very difficult to remember? Instead, if I tell you there is a source with which you can remember everything in one go, and that is nothing but pathology, the end game. Okay, so you will see that your notes, normal revision notes, maybe from Sparrow, maybe from Matia, or maybe from MTR, everything. The problem is remembering things, because revision notes are very concise and you can't remember it. That is because you don't have photogenic memory. Everything is blank, like you can't remember each and every word of it. But what if I tell you there is an idea? Let's say you want to study about myocardial infarction. What this RR notes do is they give you content in the form of lines, words, which is very difficult to remember. But what if I give you an image to remember? For example, myocardial infarction changes on day 1. See here, day 1, you're going to get these fibers. The biggest problem on day 1 is arrhythmia. Day 1 to 3, granulation tissue neutrophilic infiltration takes place. Day 3 to 7, macrophages come, tissue softening happens, papillary muscle rupture, free wall rupture. And by 1 to 2 weeks, healing occurs. Which are the most common complication? What is the most common cause of death? What are contraction bands? What is reperfusion injury? Which drugs prevent remodeling? When do the biomarkers increase? Exactly. Now, if I ask you each and every detail, whatever I have taught you just now, you will exactly remember, because it is your photogenic memory. But sadly, there is no platform available on NEETpg in India which gives you photogenic memory of content. It just tells you to by heart. By hearting is not the solution. Solution is memory. It is what you remember here that matters. Similarly, see this Hodgkin's lymphoma. Everyone tells you this has worst prognosis, this has good prognosis. But unless you have an image in your mind, you're not going to remember these things. But what if I tell you there is a source which teaches you Hodgkin's lymphoma in a very concise, beautiful manner? See, CD15, you can visualize it. CD30, you can visualize it. You can visualize all different types of classical Hodgkin's lymphoma. You can visualize what is contagious spread and what is non-contagious spread. You can visualize what are the B symptoms. You can visualize which is the most common type of Hodgkin's lymphoma, which has worst prognosis, which staging is used, which treatment is used. What are the other extra points you need to know for INICET? Everything just in one slide for revision, apt for revision. That this source is nothing but the end game. Okay, so we have released, me and my teammate Dr. Rupal, we have come up with a new source which is only visual based clue. So for pathology, we have total 80 topics, 80 high yield NEETpg topics. If you are a if you regularly watch my video, you know I only focus on high yield important things only. And that's why this pathology, out of 80 topics, we have around 75 topics which are based just on hemat-oncology and general pathology, because these two are the most important topics from NEETpg PYQ analysis. If you watch my analysis video, that is episode number 2, you would realize how pathology is completely based on general pathology and hemat-oncology. That's why I realized that when students tell me, sir, I read rapid revision, my concepts are not good, I'm not able to remember things because everything is blank content only. Then I realized there should be some source which actually gives you a visual map, a visual memory. Otherwise, you are not going to remember it. That's why we started this series. So we are going to start with pathology, which has 80 topics, and we are totally going into all 19 subjects. Total will have total 999 topics, and that's why the name 999, the end game. Okay, that is why we have kept the name 999, the end game. So it has total 999 topics, and we have started with pathology. And there are many other important things in this PDF. Not only the images, we have other things also I'll be showing you. So this is the timetable that I had given to students. I realized that some students told me, sir, RR videos are very extensive, I can't complete it. If I go to BTR, I don't understand concepts. So what should I do? So that's why I have released this video, this 999 endgame pathology, in connection with my syllabus only. So before January 12, I want to release pathology and anatomy, so that if you have not finished pathology, you can just watch this video available on YouTube, and you can watch anatomy video that will be upcoming. Okay, and then we'll be going to PSM and ortho, then we'll be going to pharmac and psychiatry. So everything will be in an organized manner, and by March 31, we will release all the subjects, 19 subjects together. Okay, so let's say this is how 999 pathology PDF endgame looks like. Like let's say chronic myeloid leukemia, you exactly know that it is 922, but you always forget this in exam. So now you will never forget after seeing this. There is fish image also, there is the translocation type also, which type of translocation happens, there is tyrosine kinase overactivity, which is visually represented, there is all these symptoms that occur. Now everything is given in detail. Basophilia is given, left shift is given, imatinib is the drug of choice, tyrosine kinase inhibitor, that is given. There are some extra points also, like first line therapy, if it doesn't work, why it doesn't work, which resistance is involved in it, which are the different phases of the disease, everything, whatever is required for MCQ, all these single word keywords are already mentioned in this image. And once this image is done, I'll be teaching all these things. So this is not just a PDF for you to read from. This is a PDF connected with this video image. See, this is the YouTube video, which if you go to my YouTube video, you will find it in the YouTube playlist. So the playlist name is Endgame. Okay, so 999 Endgame. In this, you will find this part 1 of the PDF, part 1 of the the whole series, in which I have taught pathology in just 3 hours. In 3 hours, we have part 1. Okay, and after explaining this image, because if you just go to the image PDF, there is no point. You will have to watch my video, and once after that, we will be solving this fill in the blanks. Why fill in the blanks? Because this fill in the blanks will help you build your memory. Like for example, which mutation occurs, in which type of WBCs are increased, what is a hallmark of CML, which scoring is used in CML, what is the treatment used in CML, which levels will you use to monitor treatment, what does blast crisis, what is other differential diagnosis of blast crisis. So you'll be fill in the blanks also, so that your memory will be very good. One is your visual memory will be there, and second, your retention will also be there. That's why if you're buying this PDF, make sure that you'll also have to watch this video. Okay, video is available free of cost. You can directly watch YouTube video also, no issues. Similarly, see this pathophysiology of shock. Every type of shock, each and every point. Remember, these images are generated keeping in mind only one thing, because in the last 1 week of your preparation, you will only have very less time to go through content. You can't go through all content, but you can go through one image and you can answer all questions that are answered in shock. For example, all type of shocks are mentioned here. What is the mechanism behind all this? What are the different stages of shock? What is compensatory? What is decompensated shock, hypotensive shock? How does it progress to MODS? What are the cellular pathways that happen during shock? And what are the image clinical clues, and how do you treat shock? Everything is mentioned in just 2 pages. Okay, 2 pages has everything. There are also extra points like rare INICET facts. There are exam traps, means where you go wrong, where you commit mistake. Many students commit mistake in ruling out 2 options, and why do they do so? Points are mentioned for that also, topic wise. There are also predicted MCQ which can come in upcoming NEET-PG. There are some important topper elimination hacks, like if there is low JVP along with hypotension, what will be diagnosis? If warm skin is there, what will be diagnosis? And there are some clinical correlation also. So everything is explained in detail in a small amount of page that doesn't take you more than 3 or 4 minutes to revise. See this wound healing, how beautifully it's represented. What is primary intention? What is secondary intention? Which are the factors delaying it? What are the phases of wound healing? I bet nowhere in this NEET-PG platforms you will come across such a resource which has so much image generation. That's why my main objective when I generated this PDF was only images and nothing else, because images are the reason for photographic memory. Similarly, see this type of necrosis, just one glance and you're done with it, and then you'll be solving this fill in the blanks. Okay, similarly, there are many topics. So total we have 80 topics for pathology, and in this part 1 I have covered total 40 topics. So what extra you should do along with this 999 Endgame PDF? You should do PYQs. Remember, you should do PYQs, and the reason why we have left this extra space now after each topic, we have left this half page. That is because so that you can fill PYQs extra details in this, so that one source will be there to revise in last 10 days. No doubts, it is as good as first aid. Okay, this is the best version of first aid that you'll get for NEET-PG and INICET. So next is GTs, which you shouldn't leave, and whatever important things from GTs you can add to this PDF. Next, custom model questions which are available. You should do questions. The basic concept behind this is, with this images and with this content, you can remember content, but you should solve questions. Solving questions is the backbone behind cracking NEET-PG. When you remember things, it is not enough. You should be able to understand how to apply also. Now with this, for example, with this images, you can remember what CML is, what are the stages, which enzyme is involved, which genetic mutation is involved, which investigations are used. Everything you'll remember. But if you want to apply that, you'll have to solve MCQs. So these 3 things I want you to do along with this 999 Endgame, which then definitely will get a better rank than if you had not used this PDF. So what is the where will you get this PDF? The link is mentioned in the comment section also, and it is also mentioned in the YouTube description also. So right now we are only releasing pathology. So pathology, it will be entire 80 topics. Okay, and then combine it with video. Unless you combine with this video, no, so this is the part 1 part of the video. Unless you combine with this video, you are not going to benefit from this PDF, because it will be minor details which you won't understand, and this video will take you only 3 hours. Remember, other rapid revisions may take you 14-15 hours, but this PDF will take you 3 hours, because when images are involved, explaining becomes easy. I don't have to make you memorize everything, because already it will be stored because of this visual mnemonics. Next, other subjects also will be released soon. Next will be going for anatomy also. So what I expect from you is, those who don't have a proper revision source, those who feel you are feeling it difficult to remember content, those who feel that you need some form of mnemonic, you need some form of easy content to remember, those students should definitely go ahead with this. I will be coming up with further videos. After this video, you'll be getting link of pathology video, like how this 3 hours video. So solve pathology. Once you go to the video, you'll understand how good this content is. So all the best. I wish you get all the good luck along with this PDF, and we'll be coming up with lot of other subjects. Okay, all 19 subjects in the coming days. All the best.